I woke up in recovery. I had a nurse that was by my side. She asked me how I was feeling, if I was feeling any pain. I absolutely was. So she gave me some pain meds. I think she gave me like 2 doses maybe of pain meds. Then she went and got my family, and they were able to come back all at the same time to see me for a few minutes because I was in the recovery area alone. There was no other patients. When they came in, they noticed that my lip was swollen. So apparently I bit my lip at some point during them taking a tube out or putting a tube in. I'm not sure. But it was pretty swollen. So another nurse came and brought me ice, and I was icing my lip for a little bit. It's gone down a lot, but it's still, you can probably see it a little bit, it's still swollen a little bit, and I have a little like gash on the inside. They brought me up to my room. We got settled in here. I was pretty woozy. I was very in and out of it for a couple of hours, just kind of laying here, talking a little bit and here and there. I felt, I didn't feel much. So the breast area itself was pretty numb because they numb you, and my doctor did a nerve block. So I couldn't really feel the breast itself, but there's lots of pressure like in my chest, upper chest, and then of course on the sides where the drains are. So I have 2 drains, one on each side. That's, all the excess fluid is draining out of. I went to the bathroom a few times yesterday. The first couple of times the nurses had to help me. That first time getting up, whew, it was a lot. It was painful. I was super woozy. I was like shuffling around to the bathroom, and then but each time that I got up, it got better, and I felt better each time. Um, and then I actually ended up going for a walk last night. So I didn't walk far. I walked maybe a couple doors down and back, but it was nice to like get up, get out of the room, and move my body a little bit. So overall, I felt really well. The nurses were really good about keeping me on my pain meds every 4 to 6 hours. Um, I've been drinking my fluids. They were also giving me fluids through an IV, and they also gave me antibiotics through an IV. So I had 2 types of antibiotics while in this room, and one of the antibiotics I had twice, 2 doses of. So antibiotics, fluids, pain meds, nerve pain meds, and stool softener, like a gas medication to keep the gas down in my belly. It's with all the other meds going on. So that was day 1 or day 0, I think is what they call it. Overall, did really, really well. My doctors were phenomenal. The nurses have been great, giving me really good information on, how to recover, how to take care of myself, and just make the recovery process a lot smoother.